Hello everyone, I am Deepika Pathak. Today I am here to discuss the topic of drug information services. So we'll do what do you mean by the drug information center, what is the poison information center, and what are the services in the drug information and poison information center, how to handle the queries. So let's start with the drug information services. Yes, so drug information center refers to the facility specially set aside for and a specialization in the provision of drug information. So every information related with the drug, the aspects could be, we can see its purpose mainly authentic, individualized. So we want here the information should be unbiased, it should be accurate, all the information related to the drugs as we are dealing with the drugs. So the information should be accurate, it should be relevant, and it should be unbiased. So for these all the points, what we are doing here, we are recommending the drug information center. Drug information center. Similarly, for the poison related issues, what is this? There is a poison information center. So we'll do one by one what do you mean by this type of center and poison information center. Now coming to this points, the main purpose is the unbiased information, authentic information to the consumers. Means anyone, if anyone want to take the information related with the drug, they can go to the drug information center. And the healthcare professionals, of course, if any physician, nurse, pharmacist, they want to take the information, they can also go to the drug information center, they can ask their queries. So this is the main purpose for which there is a drug information center. Now, who is the main key role in the drug information center? So the pharmacists are the key role of the playing a key role in the drug information center. Why? Because they are more specialized in the drug information. So as medicine expert, pharmacist plays an important role in communicating appropriate drug use. How to use the drug? Means what are the drug indications and its administration, what is the dosage, which is the safest dosage for a particular drug, its side effects, the storage condition, as many of the drugs get deteriorate if they store in another conditions. Some are for refrigerator, some are for the room temperature. So accordingly we have to put it as their storage conditions are required. Now there are some of the interactions. So the pharmacist will also tell about the interactions. Interactions could be any, like a drug can interact with another drug. When this happens, this only happens in the condition when the patient is suffering from the comorbid situation. Means the patient is suffering from the diabetes and hypertension, a patient is suffering from the diabetes and neurological disorders. So any 2 or 3 diseases the patient is suffering at the time the patient is taking many of the medicines. What happens? There is a chance of the drug and drug interactions. The pharmacist will can tell about the drug and drug interactions. There could be drug and food interactions. Sometimes what happens? Food will interact with a drug. Sometimes milk will interact, milk can interact. Similarly, sometimes alcohol, there could be the alcohol, there could be the smoke. So these all things can be under the drug and food interactions. Another is the drug and herb interactions. So sometimes what happens, the patient is taking some herbal supplements, maybe due to reducing the symptoms, and sometimes what happens, the patient is taking as a dietary supplements. So there may be the chance of the drug and herbal interactions also. At the time, the pharmacist will tell about the drug-food interactions, drug-drug interactions, and drug and herbal interactions. Therefore, more likely to be the first person. That's why the pharmacists are playing a key role in the drug information center. Now coming to the next point is the functions of drug information center. Means if the drug information services are provided by the drug information center, So what are the functions? So as the name shows, it is giving the information in every aspects of drug. In every aspects of drug means the dosage, the interactions, the use, the indications, the precautions, contraindications, everything. So see here, it is written the information, the common thing is the information here we can see, the information regarding the therapeutic uses of drugs. Means a particular drug is used, this the word shows therapeutic use of drug shows a particular drug A is used for hypertension, a particular drug B is used for the diabetes. So this is all thing a patient or any physician or any health professionals can take an inquiry from the Drug Information Center. Now the information on dose, I told you in the previous slides, the function as a dose, they will tell about the dose, they will tell about the administration, how to administer the drug. Sometimes what happens, there is a problem with the administration of drug. Patient don't know actually how to take the drug. Means some drugs are for the oral preparations, some are which need the dilution, some drugs for the IV, some for the some for IM, some for SC, subcutaneous. So this information also a pharmacist will tell from the Drug Information Center to the inquired one. Now information on drug. I told you in the previous slides all the interactions related, the patient or the physician, if they have any inquiry, they can ask from the Drug Information Center. Similarly, any adverse drug reactions of a particular drug, if any inquiry a physician have or a common person have, they can ask from the Drug Information Center. Similarly, what are the indications, what are the safety indications, means a particular dose which is safe for a particular drug. Like a drug A is safe up to 500 mg or up to 1000 mg. So this information also a common person or a healthcare professionals can take from the DIC. Similarly, the information related to the pregnancy and lactation, some of the drugs which are avoided in the pregnancy and lactations because they are impacting the child, the baby. So at that time, these drugs can be inquired by any of the health professionals or common person. Availability or substitute, if any substitute needed when there is no drug present in a pharmacy, no brand present in the pharmacy, at that time any substitute can be asked from the DIC for that particular treatment. Now formulary decision. Similarly, the DIC is also working for the formulary decision. In some of the previous PPTs I told about the formulary decisions for making hospital formulary in which there is a compilation of every drugs written in a particular booklet. We call it as a hospital formulary. So these decisions are also taken by the DIC. There is also one of the function in the continuous education program, as the professionals who are working in the DIC, they are also working for the dissemination of unbiased drug information. So they are giving the information not for the sake of any company, not for the sake of any hospitals, they are just giving the information which is accurate and reliable. And this I told you in one of the previous slides, that what is the basic or what is the basic purpose behind this DIC, Drug Information Center. This is the accurate and unbiased information. So any person who have any inquiry related with the drug in any of the aspects, they can ask to the DIC. Drug information related to academic and research. If any person who is in the academic or in the research, they can ask any information related to any drug. So this is how the Drug Information Center is working in this area also. There is a continuous education programs, means as they are providing the accurate, relevant or unbiased information. Therefore, they are also working for the continuous education program. They are providing training, they are providing educational programs to the hospital staffs, for the graduates, for the undergraduates, for the postgraduates, students. Now, drug information center. So, who are the working professionals? The question arises now, who are the working professionals for the drug information center? So, let's see who is working there, who is giving information to layman or to the pharmacist or to the healthcare professionals or to the patient. So, who can get the information? There is written as who can get the information from the DIC. As in the DIC, who is working? The healthcare professionals are working. They are giving information. And in healthcare professionals, who could be? Of course, physician could be, pharmacist should be there, nurses should be there. So, this is a committee how they are working. But now, there is also one of the question that who can take the information? So, physician can take the information, pharmacist can take the information, nurses can take the information. Of course, if I talk about the nurses, what information they will take? How to administer a drug, if there is any new drug, what is the dose of a particular drug, is there any new brand there, yes, or if any new substitute. So, this type of information the nurses can take. Similarly, pharmacists can also take the information from the DIC. Medical and paramedical students. So, these students also take the information for the research or academic purpose or as a training purpose. Research scholars are also, they can also take the information. Other healthcare professionals beside these, it could be the lab technician or any others. Patients and individuals. So, patient can take the information from the DIC. Similarly, there could be the layman, there could be the common person. They can also take the information from the drug information center. Now, what are the places where we can see the drug information center? So, it is on the basis of the state pharmacy council. Similarly, there is from the WHO India country office. What is written here is the WHO India country office in collaboration with the Karnataka State Pharmacy Council. They are supporting 5 drug information center. So, basically, WHO India country office, by this, there are 5 offices. There are 5 centers we can say. So, what are these centers? These centers are in, one is in Haryana, another is in Rajasthan, then is in Assam, Chhattisgarh and Goa. So, there we can find the centers which is in collaboration with the Karnataka State Pharmacy Council and WHO India country office. Similarly, there are some other drug information centers. They are run at the State Pharmacy Council. So, if I talk about the State Pharmacy Council, what are these centers? Let's see. First is in the Maharashtra. So, a drug information center, Maharashtra State Pharmacy Council. Another is the Andhra Pradesh. It is in Andhra Pradesh. Second is in third is in Jaipur, Rajasthan. Fourth is in Raipur, Chhattisgarh, and another is the Karnataka Pharmacy Council, Bangalore. There are other DIC centers in this state, but these are some of the few examples I have mentioned here in this slide. So, after completing the what is a drug information center, what are the services, the functions, and where these centers are located actually, we have another center. In the previous slides, I also mentioned there is a center called as the Poison Information Center. Similarly, as Drug Information Center is working. So, as the name mentions, the Poison Information Center, it means we are dealing the every aspects of the poison. Means how the poisons, their nature are, how the management will be done. So, these points are covered here. The Poison Information Service deals with risk assessment. I told you what is the risk means. Any poison, if I'm taking an example of a snake venom, this is a poison. So the management of it is discussed under the Poison Information Center. The risk assessment means any poison can cause the minor injury, minor toxicity. It could cause the major toxicity, severe illness. So this is called as a risk assessment. So this is studied under the Poison Information Center. How to diagnose it means there are some of the signs and symptoms associated with different poisons. Management, this is very important. If we know that this is a particular poison, the patient is affected, then we should know how to manage it, how to reform the conditions. So there are some of the therapy plans for it. And the prevention, how we can prevent the exposure. So exposure can be by any of the route. It could be by inhalation, the patient had taken it and there are many reasons. It could be incidental, it could be accidental. Exposures to poison in patients of any age respective of type. I told you, patient can take it intentionally or accidental and route of exposure. So these all points will be discussed in the Poison Information Center. The basic purpose is, what we want in the Poison Information Center is we want to reduce the morbidity, means to reduce the signs and symptoms. And want to treat it. So this is studied under the Poison Information Center. Any person can ask the query, can ask the information, can get the information about the management of Poison Information Center, related with the poison. Now mortality means we want to reduce the death rate. So ultimately what we want here is, why we have set up a Poison Information Center, it is reducing the morbidity and mortality caused by the poison and improve the patient's health related quality of life. Now there are some of the functions of Poison Information Centers. As the Drug Information Center is working, similarly Poison Information Center is working for the patient management. Patient management of course related with the poisons. How to reduce the signs and symptoms and the death rate. Toxicological analytical services means aspects of the poisons present in the body. Which type of poison it is? What is the dose? So these all points are under the toxicological, means about the poisons present in the body. Toxicovigilance means this adverse effects. What is the effect on body? How the poison is, poison is affecting to a person. So and also the exposure. This is also studied under the pharmacovigilance. Then there is also one of the thing, when we get to know all these information about the poisons, what we want is the education and training program. So we want to spread the information, and who is we here is the Poison Information Center. So prevention of poisoning, and we want to prevent it. We want the researching in poisoning. Further research means what is the basic nature, how we can reduce it, what are the receptors. So these models are studied in the research in poisoning. Then of course after the researching and all, there is also one of the function is the development of protocols. So in the protocols what we are doing, we are giving a particular poison and how to manage it, at which dose it is giving the severity to the patient, and how to manage a particular condition. So these all are the basic functions of the Poison Information Center. Now as we have discussed in the DIC, who are the members participating in the Drug Information Center, similarly the PIC is staffed by, in the PIC who is working members, physician, medical director, pharmacist, administrator. Administrator means the in charge of the hospital. In charge of the hospital, different departments. And as it is the Poison Information Center, of course there should be a member called as a clinical toxicologist who studied about the poisons. And there is a Poison Information Specialist with required secretarial assistance. There is one point which need to be noted here is there is the first National Information Center which is in AIIMS, New Delhi in 1994. Now coming to some of the examples of the poison information centers where they are located. So these are some of the example. The example number 1, we can see Christian Medical College Hospital. The poison or alcohol information center is there. Department of Pharmacy Practice, Chidambaram, Tamil Nadu. Also there is a Naipur, Chandigarh, and another is the Drug Information Center, Annamalai University. Another is in JNU. So Jawaharlal Nehru Medical College Hospital, Karnataka. Now coming to systematic approaches in handling drug or poison information inquiries. Now the question arises when any person asks any question regarding the drug, or the person could be anyone, it could be the physician, it could be the pharmacist, it could be the layman. So how a drug information or a poison information center will answer? So there are some of the basic steps. Let's see what are the steps. First, step number 1, obtain the requested demographics. As everyone cannot understand the medical language, so it is very important to take the demography. Whosoever is asking the question, according to the background of the person, they will answer. Point number 2, step background information. I told you the person whosoever is asking could be the physician, it could be any layman, it could be patient. Everyone have their different level of understanding. So it is very important to know the background information, and then we try to understand the patient condition. Means what is the inquiry? The inquiry could be drug for the hypertension, for 2-year child. So this could be the patient condition. We'll try to find in the step number 3. Then what we will do, of course, every information is taken from the here for the drug information center or the poison information center, the information is taken from the softwares, computer software. So these information will be taken by the search strategy. One of the example here is the Poisindex. Similarly, there are other softwares dealing with the information of regarding with the drug or a poison. So these type of centers, they can evaluate the information from these type of softwares. Then after evaluating the information and on the basis of the background who has asked the question, they could be any one of them, then these centers evaluate and provide information. And after giving the answer, so the answer could be, this is the query, answer could be, it could be, I am just taking an example, it could be metoprolol, XYZ mg. So like this, conduct the step number 6. After giving the information, it is very important to do follow-up. Follow-up means how the drug is affecting to the patient. Is there not any side effects, not any adverse effects, and documenting. Follow-up and documenting. Then of course, in the whole of these steps, it is very important that whatever the information the drug information center has given or any query they have received, they will not disclose it to the public. So the point number 7, it is very important to maintain the confidentiality. Now let's see what we have discussed in whole of the slides. Here is in the DIC and the PIC, means Drug Information Center and the Poison Information Center. So these are some of the basic differences. What is here differences? We can see the DIC, the clientele of the service, means who the people who are asking the questions from the DIC or the PIC. So for the DIC, we can see mainly healthcare professionals are asking. They have the queries related with the drugs. As they are prescribing in the hospital, they are administrating in the hospital or dispensing in the hospital. For the PIC, Poison Information Center, mainly general public are asking the question. So this is a basic difference between these type of centers when we talk about the clientele of the service. Similarly, the second number point, call volume. So call volume is minimum in the DIC because generally healthcare professionals ask questions when there is a complex therapies, when there is any new query regarding the drug. So as they are also known with the drug, so the call volume is less in the DIC. But for the PIC, mainly the general public is asking questions, so it could be minimum. Call complexity is high. I told you they are the professionals, so they will ask when it is actually required in the case of the complex therapies. And similarly, for the call complexity, they are the layman, they are the general public. Of course, the call complexity is low. Reply time is more because we have to evaluate more of the data, whereas reply time for the PIC, Poison Information Center, so poisons, they are affecting the patient and they can go for the death of the patient. So time should be less and it should be immediate. The working hours, it is for the regular working days, whereas the PIC working hour is for whole of the 24 hours and full of the year. Staff requirement is less here, whereas PIC the staff requirement is greater here. Financial support, we can see DIC is sponsored by some of the institution, whereas the Poison Information Center is sponsored by the government or any of the non-government authority. So this is the basic difference. Hope you got it about the DIC and PIC. So thank you so much and we'll meet in the next session for next lecture.